Hello and welcome to A Southern View. I'm Peggy and we're coming to you from Tupelo, Mississippi. I have Yvette, Dr. John Phillips, a doctor here in Tupelo.
Gastroenterologist.
Bev.
Valerie.
Valerie. And so let me ask you this, Dr. Phillips. Are we supposed to be happy about this new medical bill that's just been passed?
Healthcare reform.
Healthcare bill. Are we happy? Are we jumping up and down? Is it a good thing?
You're asking me personally? I'll tell you no. You ask most physicians that I have talked to in our area, in our medical community here in Tupelo, the anger is palpable.
Ooh.
As the President said, this is such an important piece of legislation. It's over 2,400 pages long, and I suspect, I don't know, but I suspect not a single person who voted for or against it, either one, actually read it. If you actually sit down and go to any one of numerous government websites to read this bill, it is extremely hard to read.
What does it mean for the future, for medicine, for people that think that they're going to have this great insurance? What does it mean for them?
Well, break it down.
I'm
concerned about the older generation. What does it mean for people that are on
65.
Medicare right now?
Let me set a couple ground rules down so that everybody's on the same page. Because my impression for most Americans is we're very fair people. If we all are given the same set of facts and information about something, most of us are going to come down on the same side because we all have a sense of what's right and what's wrong. Here we have a piece of legislation that everyone says, yes, this is very important. It's over 2,000 pages long. The people who voted on it haven't read all of it, and they ram it, or not ram it, but they push it through Congress so quickly without having an opportunity for everybody to really read all of it. So, when you talk about Medicare, there are different components of Medicare. Medicare Part A, Part B, Part C, and Part D. Basically, Medicare A covers your hospital bills. B is what you pay for your doctor. C is the supplemental insurance. And D is the prescription copay for your drugs. Okay, so people don't understand that Medicare, which was established in like 1965 by Congress, and people have been paying into that through their paychecks every year, that in 2017 Medicare will be bankrupt. So now what they have hoped to do with this is be able to provide insurance to 30 million people who don't have it. Well, that's all fine and good. I think that's a noble cause. The problem, though, is what kind of insurance are they going to get? Medicare right now in the state of Washington, for example, to get some of the representatives in that state to vote for this, right now 30% of doctors in the state of Washington will not see a patient with Medicare. The Mayo Clinic in Scottsdale, Arizona, one of the satellites for the Mayo, they're going to stop seeing new Medicare patients.
Really?
Because the reimbursement before the cuts that this bill has put in is so abysmal.
So the old people are not going to be seen.
So that's correct. So you're adding 30 million people at some point to be covered, but there's going to be, not only there's not going to be anybody to see them, but doctors who are seeing patients like this now, if you lose money seeing patients, you eventually are going to say, we can't see these people anymore.
People don't understand. How are you losing money?
Well, let me tell you, look, in our practice in Tupelo, we have a clinic that's known as the Good Samaritan Free Clinic that was established many years ago by Dr. Antone Tannehill, and a physician here in this area. And it provides free medical care to working people who don't have insurance. And virtually all the physicians in this medical community volunteer their time. We do that. We volunteer there one day a month, and we do that very gladly because we want to do it.
And all their problems you also take care of, like scoping, if they have scoping problems,
right.
all
If
that stuff.
If a patient has
Gynecological problems,
if
anything.
If a
Yeah.
patient's got an orthopedic problem and I happen to be
Right.
working there, it's easy if they've got abdominal pain or they're having rectal bleeding or they need a screening colonoscopy, I can take care of that. If they're there with knee pain or shoulder pain, Lord knows I'm not the person to take care of them, but I can pick up the phone and call
Right.
whatever specialist who's in this community, and they will take care of that patient. We all do that because we want to do that.
Yes.
We do that of our own volition. But when people tell us we're going to have to start doing that and continue or to provide that kind of care, that's when most of us bow up. In our state, as an example, in our group, when we still openly see Medicaid patients. Many physicians in the state refuse to see Medicaid because you literally lose money seeing those patients. Our group, we get paid about 7 cents on the dollar.
7 cents on the dollar?
For seeing a Mississippi Medicaid patient. If I want to go to a grocery store, if I want to go to have to Lowe's, if I go to a hamburger joint and they tell well it's going to be $5. Okay, well I'm going to pay you 35 cents for this, which would be the equivalent
Of what they get paid.
yeah,
You wouldn't
of what
get
we
it.
get paid.
They would turn you away.
Or an electrician, or a plumber, I mean, or
Well,
a
I don't
home
think
builder.
that people really understand.
They don't understand.
They don't understand what it takes for a physician to run an office.
We can't do anything about this bill that's now through. But what people need to understand is the taxes that are going to be put on a lot of people. I'm not going to try to, who knows what all they are because there are so many taxes that are in.
Yeah. There's a few things I was concerned about, and I was trying to logically understand this. They were talking about taxing or the medical device companies and several companies making payments to the government or taxing the government or being taxed by the government. And I was thinking, for example, like a pacemaker company or that sort of thing. If they're requiring these companies to pay the government money when someone needs a pacemaker or that type of thing, then those costs are going to go to the hospital. Obviously, the patient will not be able to absorb these costs.
Right.
But if the hospital is being subsidized by the government, will the government not just give the hospital more money? I don't see how that's cost effective. I don't understand that portion of it.
You're preaching to the choir.
Nobody understands.
Yeah, ambulatory surgery centers are an example where your costs are bundled frequently, which means if you do a certain procedure, you get X amount. Okay.
Right.
Now, outpatient procedures, ambulatory surgery centers are much more efficient than anything that's done, or those type of things that are done in the inpatient or as a hospital setting. They're much more efficient, can be done cheaper. Or less expensive, I don't mean to say cheaper, but let's say you're doing a procedure in an outpatient in an ambulatory surgery center and that patient has a couple of different things going on and you need to use several different pieces of equipment. Well, you only get X amount and that's all you get. So if you decide, well, it'd be better if I use this tool or that other tool or another tool on this patient, but if I do that, then I not only don't break even, I may end up losing money trying to do what's best for the patient. And that's a position that physicians don't want to be put into.
Right.
We want to be able to take care of our patient. Those type of procedures, when they're done in a hospital setting, all those costs are allowed to be passed through. So that if you decide to use 3 or 4 different pieces of equipment, all of those costs at a marked up rate, I might add, all are allowed to be passed through.
But so how can you have the best interest of the patient at heart when all these other things are dictated to you and you wonder if you can even keep your practice
You
open?
can't do it. I mean,